Welcome to Unit 10, Introduction to Clinical Chemistry. The Clinical Chemistry Department can be one of the most challenging departments you will ever work in due to the highly technical equipment, quality control, calibration, maintenance, and sometimes just the sheer volume of work performed. The number of different types of chemistry analytes which can be ordered and analyzed will boggle your mind. The most fascinating aspect of chemistry is learning the clinical significance of each test, as well as putting together a number of abnormal results to come up with a possible diagnosis or disease. I grow weary of the common misconception that laboratorians are just button pushers. Yes, we push buttons, but our skills are in the interpretation of all the data produced by these instruments. We are scientists. Clinical chemistry is the largest department in the clinical laboratory. Testing is performed on all of the following types of sample: serum, heparinized plasma, urine, and body fluids such as spinal or joint fluids, with serum or heparinized plasma being the most common. It's highly automated, and again, we're talking about highly technical instruments that require a high level of expertise to operate. Depending upon the size of the facility, it will be broken down into a variety of different departments. Routine chemistry, which are chemistry tests that are ordered at all healthcare facilities. And then there may be specialized chemistry departments, such as immunoassays, tumor markers, therapeutic drug monitoring, toxicology, and trace elements and nutrients. There are over 700 different kinds of chemistry tests which can be performed. The variety of tests performed in a clinical lab will be dependent upon the patient population being seen or treated. In a hospital, there's going to be a wide variety of tests due to the variety of patients admitted. Perhaps we have surgical, cardiac, OB/GYN. Specialty clinics, physicians who specialize in a specific patient population, such as family practice, or specific disease states, such as endocrinologists. They will have limited test menus to diagnose and monitor specific diseases in their population. And I'll throw in here that for every test that you offer, you have to perform quality control every day. You have to enroll in competency assessment, which is 4 times a year, and it costs money. You have to calibrate. You may have to do some additional maintenance on these instruments that perform the specific tests. So each test costs a lot of money. So in order for you to get ROI, return on your investment, you need to be able to perform enough tests so that it offsets the cost of performing them and that you make a profit. Chemistry tests are usually pooled together into panels, and a panel is a collection of tests used to either screen or diagnose and monitor a disease or a condition. Panels are usually much more effective to run. When you enter the MLT program or any other laboratory science program, during the clinical chemistry course, you will learn about the following: the proper operation of instruments which perform the analysis, which include quality control. This is done every day to ensure the results are accurate. Calibration. This is done every 6 months because over time the instrument will go out of calibration, which will result in improper or erroneous results. And other types of procedures to ensure accurate results, including preventive maintenance. This is done daily, weekly, monthly, different parts. You will learn about the principle of the reactions occurring in the instrument. What is reacting with what to give what type of result? This is crucial for problem solving when erroneous results are produced, because perhaps a reagent tubing is clogged and it's not getting enough of this reagent to where the erroneous results would occur. So you need to be able to figure that out and problem solve. The most fun is learning about the clinical significance of the most common types of chemistry tests, which, if they're abnormal, may indicate heart disease, liver disease, kidney disease, and we will have panels. We'll have a kidney panel, a cardiac panel that we put together in a bundle, specific tests that are designed to detect problems with an organ system. Reference ranges. This is the range of results in a healthy person living in your region. Reference ranges may vary depending upon age, the gender. For some results, for example, red cell counts, the red cell count is lower in women of childbearing age than men because of the menstrual cycle. The geography. If you live at a very, very high altitude, you're going to have more red cells because you need those to transport more oxygen, whereas at sea level, our red cell counts will be lower. You will identify critical values, which are test results which are so abnormal that a patient must receive immediate, perhaps life-saving treatment. And these values must be called to the individual directly taking care of the patient and documented in the medical record. So if someone says, well, I didn't get that result and their patient had died, well, we can document in the computer, yes, I talked to Susan Miller, RN, at 5:35 p.m. I provided you with a handout that lists the tests found in each panel. There's two types of metabolic panel, and the basic metabolic panel, also known as the BMP, is a panel of 8 tests which provides information about the current status of a person's metabolism. It will include tests that will address kidney function, glucose, electrolytes, and acid-base balance. Abnormal results, especially a combination of abnormal results, can indicate a disease or disorder for which the physician will then order additional tests. The comprehensive metabolic panel is a panel of 14 tests which serves as an initial broad medical screening tool, and usually these are part of your physical exam. It contains 8 tests from the BMP along with additional tests to screen for other problems. It provides a rough check of kidney function, liver function, diabetic and parathyroid status, and electrolyte and fluid balance. Abnormal results can point to abnormal conditions, which will again require additional blood tests. The BMP or CMP are frequently ordered as part of a physical examination. This allows the physician to occasionally catch problems early. Early diagnosis and treatment may prevent serious health problems from occurring or becoming permanent. For example, early diagnosis of diabetes allows a patient to take insulin to regulate the glucose levels before they affect or cause permanent damage to the heart, eyes, or kidneys. Electrolytes consist of 4 tests: carbon dioxide, chloride, potassium, and sodium, which are salts and minerals found in the blood. These may be included in other panels or ordered as a standalone panel. It's ordered to investigate and monitor conditions that cause electrolyte imbalances, such as dehydration, kidney disease, lung disease, or heart conditions. In the southern U.S., heat stroke during the summer is very common, and electrolytes are used to diagnose the condition. May also be used to monitor certain medications, such as diuretics. Diuretics cause excessive urination and fluid loss, and that may lead to dehydration. Thyroid panel test measures the amount of thyroid substances in the blood. The results, especially a combination of abnormal results, will assist with evaluation of thyroid function, diagnosis of hypothyroidism, which is low thyroid hormone, and hyperthyroidism, high thyroid hormone, which requires intervention and treatment. And they're also used to monitor patients on thyroid medication. The test on a lipid panel serves as an initial broad medical screening tool to detect abnormalities in lipids, such as your cholesterol and triglycerides. The results of the test can identify certain genetic diseases and determine the approximate risk for cardiovascular or heart disease. Patients who are on cholesterol medication, the statins, must have their blood checked regularly to ensure the dose is still adequate, as well as to make sure it's not negatively affecting the liver. There are many organ-specific panels, and the following are the most common: kidney or renal function panels, cardiac or heart enzyme panels, and hepatic liver function panels. These panels are used to diagnose and monitor diseases of these specific organs. Changes in results may necessitate the changes in medications, surgical procedures, or other types of treatment. And it's very important to remember that the earlier conditions are diagnosed and treated, the better the outcome for the patient, and it may prevent very, very expensive interventions or lifelong disability. Special chemistry is a really cool department, and the following are the most common special chemistry departments. Larger laboratories may have more: immunoassay, tumor markers, therapeutic drug monitoring, drugs of abuse, toxicology, the study of poisons or things that may be poisonous to you, trace elements. They're present in picograms, just very minute amounts that, if they get too low or high, can cause issues with you, and nutrients. Some laboratories may incorporate a few tests within the chemistry department itself. The organization of the chemistry department is dependent upon the size of the lab and the volume of testing performed. So in the big overview, in the big picture, very large clinical and reference laboratories will have special chemistry sections. The decision to perform a test in-house, on-site, is dependent upon the number of tests ordered. Laboratory testing is most cost-effective when large numbers of the same test are ordered. The laboratory can then make a profit. If only a few tests are ordered, as I said before, then the cost per test will be prohibitively expensive and the laboratory will lose money. So these tests are then sent to reference labs where, since many clients across the United States will send their samples in, the volume of testing is very high and they can make a profit. Laboratories will have a send-out area where specialty tests that are not performed on site will be sent out to the reference laboratories. And there's Quest, there's CPL, there's LabCorp. There's a lot of huge reference labs across the United States where, again, they can keep the costs down because they do testing for the entire country. The following slides will give a brief description of the most common special chemistry sections. Immunoassays are biochemical tests which measures the presence or concentration of antibodies, and these are proteins which you produce when exposed to a foreign substance, such as a bacteria or a virus, or the antigen, which is the actual virus or bacteria that is foreign to you that you produce the antibody against. Right now, COVID is big time in the news. We rapidly develop tests to detect the presence of either the antibodies or the antigens. And one thing you must always remember is the quick test. There's limitations of the procedure. There are things that cause false positives and false negatives. For example, the infectious mono, the quick test, is 80% accurate. And these different COVID tests that have been coming about, you've heard that, oh, they tested negative and then they tested them again and they were positive. Well, that's a limitation of the procedure. If there's not enough antibody present, then we'll get a false negative. And so a lot of work is done to create these tests. And again, the limitations of the procedure are always that an infection may be too recent and there may not be enough of the substance present to detect yet. So later on, getting a positive is no surprise. So when we're performing these tests, there's a lot of different chemical reactions that can be used to determine an endpoint. Chemiluminescence, think of those glow sticks. There's procedures that we have that use these as markers. Radioactivity, we use a marker that's radioactive labeled, and if it attaches to the substance we're looking for, then we can measure the radioactivity produced. Fluorescence, same thing, we put a fluorescence tag on it. If it binds, then we get fluorescence, and many, many others. This will make your head spin when you're learning about the different types of reactions that can be done to identify or detect targets. These tests may be performed in one department or in other specialty departments, such as tumor markers or nutritional assays. Tumor markers are expanding exponentially, and tumor markers are substances, often proteins, that are produced by the cancer tissue itself or sometimes by the body in response to cancer growth. Because some of these substances can be detected in body samples such as blood, urine, and tissue, these markers may be used along with other tests and procedures to help detect and diagnose some types of cancer, predict and monitor a person's response to certain treatments, and detect recurrence. More recently, the idea of what constitutes a tumor marker has broadened. Newer types of tests have been developed that look for changes in the genetic material and the DNA and RNA of these tumors rather than proteins in patient samples. The genetic changes have been found to be associated with certain cancers and can be used as tumor markers to help determine the prognosis, what are the chances of you living, guided targeted treatment, and or detect cancers early on. The list of markers continues to grow. Here is a list of some of the specific markers found in a variety of cancers. And again, the list continues to grow. You don't need to memorize these for this course, but I just want you to be aware that tumors in different tissues will have different markers. So colorectal cancer, breast cancer, ovarian cancer, uterine cancer, prostate cancer, testicular cancer. And one thing about getting these done, especially if they're genetic, for example, the BRCA1 for breast cancer, I did not get that test done. I have a very strong history of breast cancer in my family. 2 maternal aunts, my mom, my grandmother. And I finally decided what I would do, because if the test was positive, I would have elective surgery. At a certain point in my life, I was not ready to make that decision, but I finally came to the conclusion that yes, this would be the right decision for me. I had the testing done. It was interpreted by a geneticist who sat down with me, and I was negative. So now I got to figure out, well, what else could cause the cancer that runs in my family. And the National Cancer Institute has a wonderful website with information and resources for you if you decide to go into MLT, or just if your family member has cancer. It's some interesting information. In the laboratory, there are 2 types of drug testing. One is therapeutic drug monitoring, and the other is drugs of abuse testing. Therapeutic drug monitoring, or TDM, is a branch of clinical chemistry and clinical pharmacology that specializes in the measurement of medication concentrations in the blood. Its main focus is on drugs with a narrow therapeutic window. The process involves the measurement of specific drugs at timed intervals in order to maintain a relatively constant concentration of the medication in the blood. Monitored drugs tend to have a narrow therapeutic index, a ratio between the toxic and therapeutic doses of medications. Many of the drugs that require therapeutic monitoring are taken for a lifetime. They must be maintained at a steady concentration year after year while the person ages and goes through life events that may alter that individual's therapeutic level. Over time, people may acquire other chronic conditions that also require lifetime medication, and that may affect the processing of their monitored drugs. So therapeutic drug monitoring follows these changes and accommodates them. TDM identifies patients who are non-compliant when the person does not take the medication regularly as prescribed, and the effect of drug interactions, which may cause drug concentrations that are higher or lower than expected at a given dosage. And this helps to personalize a dose to fit the special needs of that patient. So again, it's very important. That's where the pharmacist, it's really important that you always go to the same pharmacist because they can save your life. Dr. A ordered these medications, Dr. B ordered these medications, and they try and do a good job of finding out what you're on, but because of the combinations, the pharmacist says, whoa, this drug cannot be taken with this drug, and your physician will need to find something else. So your pharmacists are very, very important in being the gatekeepers to your health care. Through years of testing, the optimum therapeutic ranges for drugs have been determined. In these ranges, most people will be effectively treated without excessive side effects or symptoms of toxicity. The drug dosage necessary to reach this level must be determined for each individual patient. This website provides a list of the most commonly monitored drugs and their purpose, and there are many more. Drugs of abuse. This is also known as drug screening, a drug test, substance abuse testing, and a toxicology screen. The drugs of abuse include alcohol, marijuana, cocaine, benzodiazepines, barbiturates, opiates, and amphetamines. The list continues to grow. Drug screening has now become a routine part of the hiring process for many companies. Individuals impaired by drugs may not be able to perform the required tasks. They may be frequently absent, and or they may steal to support a drug habit. In the medical setting, the test is performed to screen for drugs of abuse, to monitor someone with a substance abuse problem. As you know, if somebody is a drug addict, part of their therapy is to, on a regular basis, have their urine or blood tested for drugs. To monitor compliance with prescribed medications. For example, you're supposed to be taking insulin and you're not, and your glucose is getting way out of control. That can end up killing you. It can lead to heart disease, amputations. So again, it's very important that if a patient is on medications for an extended period of time, that they are monitored. To detect and evaluate drug intoxication or overdose, patients come into the ER, don't know what's going on with them. They do have rapid drugs of abuse screening that they can determine what drug is present or on board, and then there's specific treatments for different types of drugs. Follow this link to a short article called An Overview, Drugs of Abuse Testing in the Clinical Laboratory Today. If the link doesn't work, then copy-paste the title of the article. In testing for drugs of abuse, urine is the most frequently tested sample. Obtaining a valid urine sample may be challenging, as individuals are known to adulterate their sample to try to hide or delete the drug. They provide a sample from someone else. They substitute their sample with one purchased online. They use water and other substances. Do a quick web search for clean urine. Yes, you can actually buy clean urine. And for guys, they would put it in a pouch attached to their leg. And then there's a tube that goes up and they tape it to their penis. And so it looks like they're peeing when in fact that what they're doing is they're squishing this other fluid into the container. I've seen things and heard things. One of my students, a phlebotomy student, in the restrooms where they do these collections, they turn off the water, they put a bluing agent in the toilet, and that way if you try and dip water out of the toilet or you try and fill it with tap water, not going to happen, not going to work. And they will go ahead and test the sample's temperature, because urine coming out of your body should be body temperature. And we had someone, I'm not going to say in what way I know them, but they said, oh my gosh, their stuff at this lab is just all wrong. I said, what do you mean? He said, well, I gave my urine sample and the thermometer on the container was not working, because it has a thermometer right on there to determine the temperature. And then they stuck a regular thermometer in the urine sample, and that wasn't working either. And I'm like, oh my God, you put somebody else's urine in there. It wasn't yours. You didn't warm it up. And yeah, they caught you. There was another time that a person came and they gave their sample. And what they'd done is they filled the container with soap from the soap dispenser. I don't know. Desperate people, desperate measures. Toxicology is defined as the branch of science concerned with nature, effects, and detections of poisons. It involves observing and reporting symptoms, mechanisms, detection, and treatments of toxic substances, in particular relating to the poisoning of humans. A poison is defined as a substance which administered either deliberately or accidentally that is capable of causing the illness or death of a living organism. Medical toxicology is a medical subspecialty focusing on the diagnosis, management, and prevention of poisoning and other adverse health effects due to medications, occupational and environmental toxins, and biological agents. Toxicology may include testing for drugs of abuse as well. There are hundreds of drugs and toxins which may be tested for. This site gives a sample list. And it's of interest to know that people forever, for hundreds and thousands of years, try to kill someone off by poisoning them because the poison will make them ill, and the person who is murdering them want them to appear to have died of natural causes. Fortunately, in this day and age, it's very difficult to do. The toxicology department utilizes highly technical, extremely expensive instruments such as mass spectrometers and liquid chromatography to identify the substances which may be present in very, very minute amounts. We're talking picograms or nanograms. Testing performed in the hospital is different than that testing performed in forensic pathology. Forensic pathology focuses on the cause of death, and we are seeing a dramatic rise in deaths due to drug overdoses. And I have the link to this, which you may find of interest, toxicology tests and autopsies. The last item of discussion is trace elements and nutrients. A trace element is defined as a chemical element required in minute amounts by living organisms for normal growth. Dietary micronutrients and essential minerals are needed in very minute quantities for the proper growth, development, and physiology of the organism. Some examples include cobalt, copper, fluorine, iodine, iron, manganese, molybdenum, selenium, and zinc. Sounds like you can make a song out of that. Deficiencies can occur worldwide when there is insufficient food, insufficient variety of food, and or mineral deficiencies in the soil that food is grown in. And farming is a science because there's so much that goes into what is composed of the dirt. Do we need to add additional nutrients and so on, because that goes into the vegetation. And that's, if you eat a healthy, well-balanced diet, you don't have to worry about the micronutrients because you are getting them. But again, if you are living in an area where food is hard to come by, then you could develop a lot of diseases or disorders due to deficiencies. That is the end of this presentation. If you have any questions about the